ABC 10 News at 4 starts now.
San Diego businesses wait anxiously for the decision that could let them reopen now or lead to permanent closure. Plus, as the state cracks down on private parties, how the sheriff's department is targeting businesses that don't shut down by curfew when a new stay-at-home order takes effect tomorrow. But first, we are following breaking news in Wisconsin, where several people are injured in a mass shooting, this all near Milwaukee. The shooter is still on the run. Right now, there is a massive police presence at Mayfair Mall, that's in Wauwatosa, which is just west of Milwaukee. The police wrapped up a quick briefing about 10 minutes ago. Here is what we know right now. Medics responded to reports of a shooting at the mall just before 3 p.m. local time. Inside the mall, medics found 7 adults and 1 teenager shot. The extent of their injuries are not known, but there are no reports of any fatalities at this point. And witnesses could only describe the gunman as a white male in his 20s or 30s. We will keep you updated as this breaking situation keeps evolving in Milwaukee. This just in, President Trump's son, Don Jr., has tested positive for coronavirus. A spokesman says the younger Trump says that he has been quarantining at his cabin since the result earlier this week. Don Jr. is the president's second son to test positive for the virus. His youngest son, Barron, was diagnosed with it last month. And we're still waiting for a San Diego judge's ruling on a major hearing that ended about 30 minutes ago over a lawsuit that is seeking to stop the state shutdown orders. The restaurant, Cowboy Star, and the Bear Republic CrossFit Gym are all among those businesses seeking an emergency injunction. Both sectors were open for indoor operations with limited capacities under the red tier. But last Saturday's move to the purple tier forced them to shut down indoor services completely and move outside. They're suing Governor Newsom and San Diego County, arguing the closures go against their rights. The suit was filed on behalf of all restaurants and gyms.
Really rough to have to kind of shut down business again when people were starting to feel normal. And then we see the County of San Diego's Department of Health say that gyms are only 0.4% of the cases in San Diego. And it's like, it's really frustrating as a business owner to kind of have these ebbs and flows of business where we can be open, then we can't.
The lawsuit claims the shutdown will result in financial ruin and the possibility of permanent closures. Both sides made their arguments in court this afternoon. The judge said that he hopes to have a decision by 5 p.m. If not, he will issue a ruling on Monday. We'll keep you posted. California broke the single-day record for coronavirus cases twice just this week. 13,422 cases were reported yesterday, and the state average this week is nearly 120% higher than it was 2 weeks ago. Health officials now say about 12% of people who test positive for COVID will end up in a hospital 2 to 3 weeks later.
We are now possibly just weeks away from the first COVID-19 vaccine being available to select people in the U.S. Pfizer is asking the FDA today to give their vaccine emergency use authorization. Next, the FDA and outside experts meet to review the efficacy and safety data to determine if the benefits of the 2-dose vaccine outweigh any risks. If they greenlight the EUA, doses can go out immediately, but the CDC has to say to where and who first. There's a big focus on numbers during this pandemic. Public health experts, doctors, along with everyday people are constantly checking on how COVID cases are changing. Today, there are a lot of tools out there to give us a variety of information regarding cases. Some case trackers give you the number of cases in a 100-day period. Others allow you to see how many positive cases there are in comparison to total number of tests. A lot of this information can be overwhelming, especially for those of us who are not health experts. So how do we know what information to use, and should we trust it to make decisions about our everyday life? Health experts say as long as the information comes from a legitimate source like a state health website or Johns Hopkins, it can be trusted. But to make things easier to understand, it's suggested you use just one tool to get that information.
If you're traveling somewhere, you want to be able to compare your risk at home versus your risk on the trip. It's nice to have a tool that's used in both places to measure that.
Using just one tool makes it easier to understand the situation, even if the numbers vary from tool to tool.
So you really want to find a tool that, or a website that basically has a standardized method of collecting their data and a standardized method of reporting it.
The most important information will come from the 7-day and 14-day averages. When it comes to making decisions, public health experts say it's good to be informed about cases in your area, but regardless of numbers, you should still be practicing social distancing, hand washing, and wearing a mask.
California's newly issued limited stay-at-home order goes into effect tomorrow night for San Diego County and most of the state. The governor says the order is designed to stop late-night parties from spreading the virus. And while the state cracks down on what goes on in private homes, ABC 10 News reporter Rachel Bianco explains how the county is stepping up enforcement of businesses defying the orders.
San Diego headed into another weekend with new restrictions. The governor's so-called limited stay-at-home order for all non-essential activity goes into effect for all counties in the purple tier Saturday night at 10.
Hopefully, by adding this full-time law enforcement presence, we will stress the importance of compliance with these public health orders.
The sheriff says that full-time presence will include 4 two-person teams for the entire county. He says they aren't going door to door, but following up on complaints about businesses violating the public health orders. He says they'll educate before they enforce. If that doesn't work, they'll issue fines and then cease and desist orders. It's unclear exactly how the department will handle calls about gatherings in private homes. The sheriff's department wasn't available for an interview Friday, but posted on Twitter, quote, "We understand you have questions. You are not confined to your home. You can go to work, a grocery or drugstore, walk your dog, or get takeout from a restaurant. The goal is to avoid non-essential activities and stop the spread of the virus to avoid further restrictions." The sheriff says police departments in Oceanside, Carlsbad, San Diego, Coronado, and Chula Vista will go along with the enforcement. El Cajon Mayor Bill Wells says he won't stop deputies from working in his city, but he calls it massive overreach.
And they're going to be giving citations, which means that a person gets a citation has to go before a judge. And if they lose that, then they can have a criminal record for the rest of their life.
A spokeswoman with the DA's office says depending on the facts of a case, a misdemeanor criminal or civil action may be pursued. Rachel Bianco, ABC 10 News.
The county issued these orders to 3 new businesses: Alliance MMA, the Element Dance Center, and Functional Republic. The stay-at-home order is from 10 p.m. to 5 a.m. on all non-essential activity. It expires December 21st.
Let's check the news feed. We hit another devastating record: 193,000 new cases of coronavirus in the U.S. yesterday. County and state health departments report more than 1,900 deaths. We're more than double the average amount of new cases from a month ago. And COVID deaths are expected to get a lot worse in the U.S. One model predicts 471,000 people will die from the virus by March 1st. That's assuming 40 states reimpose social distancing mandates, and if they don't, that number could be 658,000. The World Health Organization is warning doctors against using remdesivir, no matter how severe a patient's illness. Emerging research suggests that the antiviral drug may not help lower the risk of death. Remdesivir was approved by the FDA last month.